How can you identify risk factors for addiction? If you're concerned about the well-being of a loved one or even your own, understanding the risk factors for addiction is a crucial step. Let's break down what you need to know to identify these risks. First, it's important to recognize that addiction can affect anyone, but some people are more susceptible due to various factors. One of the key risk factors is genetic susceptibility. If there's a history of addiction in your family, it increases the risk. Genes can account for about 40–60% of the risk factors for addiction. Another significant factor is family environment. Family conflicts, abuse, or neglect can push individuals, especially teens, towards substance use as an escape. Positive attitudes towards substance use within the family or lack of parental supervision and clear expectations can also increase the risk. Mental health problems are also a major concern. Conditions like depression, anxiety, conduct disorder, or ADHD can make individuals more likely to turn to substances to cope with their symptoms. Ensuring mental health support through therapy and medications can help mitigate this risk. Behavioral and impulse control problems are another red flag. Children who frequently take risks and have difficulty following rules are at higher risk. Teaching them better coping mechanisms, such as problem-solving and anger management skills, can help steer them away from substances. Exposure to trauma is a critical risk factor. Traumatic experiences, including childhood abuse, loss of a loved one, or natural disasters, can increase the likelihood of substance use later in life. Recognizing the impact of trauma and seeking appropriate help is essential. Environmental factors also play a significant role. Living in an economically depressed area with high crime rates, high unemployment, and easy access to substances increases the risk. Additionally, peer influence and the normalization of substance use in the community can lead to problems. Age of first use is a strong predictor of addiction. The earlier someone starts using substances, the higher the risk of developing a substance use problem. Delaying the first use is crucial, as it can disrupt brain development and lead to long-term issues. School connectedness is another important aspect. Teens who don't feel valued or recognized at school may turn to substances as a way to cope. Ensuring they have positive relationships with teachers, mentors, or involvement in school activities can help. Social factors, such as peer relations and social isolation, are also significant. Peers can provide both positive and negative influences, and social isolation can alter the way the brain measures risk and reward. To identify these risk factors effectively, you can use a risk assessment tool. These tools ask a series of questions to help you determine which risk factors are present and provide suggestions on how to lower these risks. In summary, identifying risk factors for addiction involves looking at genetic, family, mental health, behavioral, environmental, and social aspects. By being aware of these factors and taking proactive steps, you can help prevent substance use problems and support those who may be at risk.